traditional treatment, according to the lawsuits. As a result, a program devised to help lower healthcare spending has instead become substantially more costly than the traditional government program it was meant to improve. 8 of the 10 biggest Medicare Advantage insurers, representing more than 2/3 of the market, have submitted inflated bills, according to the federal audits. And 4 of the 5 largest players, UnitedHealth, Humana, Elevance and Kaiser, have faced federal lawsuits alleging that efforts to overdiagnose their customers crossed the line into fraud. The fifth company, CVS Health, which owns Aetna, told investors its practices were being investigated by the Department of Justice. In statements, most of the insurers disputed the allegations in the lawsuits and said the federal audits were flawed. They said their aim in documenting more conditions was to improve care by accurately describing their patients' health. Many of the accusations reflect missing documentation rather than any willful attempt to inflate diagnoses, said Mark Hemmelberg, an executive at AHIP, an industry trade group. Professionals can look at the same medical record in different ways, he said. The government now spends nearly as much on Medicare Advantage's 29 million beneficiaries as on the Army and Navy combined. It's enough money that even a small increase in the average patient's bill adds up. The additional diagnoses led to $12 billion in overpayments in 2020, according to an estimate from the group that advises Medicare on payment policies, enough to cover hearing and vision care for every American over 65. Another estimate, from a former top government health official, suggested the overpayments in 2020 were double that, more than $25 billion. Medicare Advantage overbilling exceeds entire agency budgets. The increased privatization has come as Medicare's finances have been strained by the aging of baby boomers. But for insurers that already dominate healthcare for workers, the program is strikingly lucrative. A study from the Kaiser Family Foundation, a research group unaffiliated with the insurer Kaiser, found the companies typically earn twice as much gross profit from their Medicare Advantage plans as from other types of insurance. For people choosing between traditional Medicare and Medicare Advantage, there are trade-offs. Medicare Advantage plans can limit patients' choice of doctors, and sometimes require jumping through more hoops before getting certain types of expensive care. But they often have lower premiums or perks like dental benefits, extras that draw beneficiaries to the programs. The more the plans are overpaid by Medicare, the more generous to customers they can afford to be. Medicare Advantage is an important option for America's seniors, but as Medicare Advantage adds more patients and spends billions of dollars of taxpayer money, aggressive oversight is needed, said Senator Charles Grassley of Iowa, who has investigated the industry. The efforts to make patients look sicker and other abuses of the program have resulted in billions of dollars in improper payments, he said. Many of the fraud lawsuits were initially brought by former employees under a federal whistleblower law that allows them to get a percentage of any money repaid to the government if their suits prevail. But most have been joined by the Justice Department, a step the government takes only if it believes the fraud allegations have merit. Last year, the department's Civil Division listed Medicare Advantage as one of its top areas of fraud recovery. It's an extremely high priority for us, said Michael Granston, a Deputy Assistant Attorney General for the Civil Division. In contrast, regulators overseeing the plans at the Centers for Medicare and Medicaid Services, or CMS, have been less aggressive, even as the overpayments have been described in Inspector General investigations, academic research, Government Accountability Office studies, MedPAC reports and numerous news articles, over the course of 4 presidential administrations. Congress gave the agency the power to reduce the insurers' rates in response to evidence of systematic overbilling, but CMS has never chosen to do so. A regulation proposed in the Trump administration to force the plans to refund the government for more of the incorrect payments has not been finalized 4 years later. Several top officials have swapped jobs between the industry and the agency. CMS officials declined interview requests. In a statement, the CMS administrator, Chiquita Brooks-LaSure, said the agency recently sought feedback on how to improve the program. We are committed to making sure that Medicare dollars are used efficiently and effectively in Medicare Advantage, she said. The popularity of Medicare Advantage plans has helped them avoid legislative reforms. The plans have become popular in urban areas, and have been increasingly embraced by Democrats as well as Republicans. Nearly 80% of U.S. House members signed a letter this year saying they were ready to protect the program from policies that would undermine its stability. You have a powerful insurance lobby, and their lobbyists have built strong support for this in Congress, said Representative Lloyd Doggett, a Texas Democrat who chairs the House Ways and Means Health Subcommittee. Some critics say the lack of oversight has encouraged the industry to compete over who can most effectively game the system rather than who can provide the best care. Even when they're playing the game legally, we are lining the pockets of very wealthy corporations that are not improving patient care, said Dr. Donald Barrick, a CMS administrator under the Obama administration, who recently published a series of blog posts on the industry. When you skate to the edge of the ice, sometimes you're going to fall in.